this video, I'm going to take you through my first 24-hour shift working my OBGYN rotation at the General Hospital in Ottawa.
First day of 24 hours. I work from 7 a.m. to 5 p.m. I have a 3-hour break, and then from 8 p.m. to 8 a.m. It's not a true 24 hours, but I have to go and meet the resident for 7 a.m. So I gotta run downstairs. Good news is I made it to the floor. Bad news is I don't know where the resident is, so I'm messaging her to see where she is.
As we wait for the resident to reply to my message, let me break down the day for you. My first shift is a normal shift. Since I'm on gynecology week, my rotation starts at 7 a.m. and then goes all the way to 5 p.m. It's a long day. I'll be working with 2 residents and the attending doctor, doing surgeries and doing consultations in the emergency department if needed. Then I'm going to have a break between 5 and 8 p.m. Then I'm going to go home, rest, and come back onto the labor and delivery floor where I'll be waiting for any patients ready to deliver their little baby.
So I thought we were rounding on the 7th floor, but the resident said to meet her on the 2nd floor at emergency. I had no clue. Maybe she had a consult. So I'm gonna go meet her there and we'll start the day, probably have a couple of surgeries and maybe some consults.
It turns out the resident started rounding on the patients by herself and was able to finish earlier than expected. Because of that, she told me to meet her at the emergency department to do a new consultation. The patient we saw in the emergency department was roughly a 35-year-old woman presenting for vaginal bleeding and decreased hemoglobin. Her blood levels showed roughly a hemoglobin of 50, which is really low. It's not good. That means she's anemic, and she was given 3 units of blood total throughout the day to make sure that her hemoglobin remained at a good level. The resident tried explaining that she wanted to prescribe TXA, which is tranexamic acid, which helps with minimizing the amount of blood that she's experiencing, which makes sense. You want to do that, right? But the patient didn't want that right now. She got a little bit scared of the acid part of the name, so she was admitted for further monitoring to make sure that she's stable before discharging her home and booking follow-up with her gynecologist.
All right, we saw a patient in the emergency room, went to the consult, now heading to the surgery room, heading to the OR to do surgery on the patient.
So the surgery that was performed took 2 to 3 hours long. I actually don't remember. It just was long, and it was a doctor with 2 residents, and I believe they ended up removing the uterus, the fallopian tubes, and one of the ovaries. So one of the things that I try to do with each surgery that I'm in is to not only get to know the doctors that I'm working with, like the OBGYN doctors, but also get to know the anesthesiologist, get to know any other doctor that's in a room, because my anesthesia rotation isn't until the end of summer. So I want to learn more about that specialty before I have to choose my electives for the next year. And I've heard really good things about anesthesiology. So I really encourage you to be curious and to ask lots of questions to anybody that you come across and work with, because you can really learn about different professions, different opportunities, and even get to make friends along the way. Consultation at the emergency department is one for vaginal bleeding, again, which is something very common when you're working in gynecology department.
All right, I was asked to go to emerge and do a consult on the patient for some bleeding, so I'm gonna make my way there.
This young patient had delivered her baby not too long ago, maybe a couple of days or a week, 2 weeks ago, I think. And there was a complication of placental abruption, which basically means the placenta was pulled off of the uterus and it caused a massive amount of hemorrhaging and loss of blood. So today she presented to the ED with excess bleeding, and the gynecology team was asked to get to know this patient to see what kind of treatment should be done. And I felt really bad for this patient because she had just given birth. The last thing you want to do is give birth, have something go wrong, not be able to hold your baby, stay a couple days away from your baby. So I can't imagine how it feels, but I was able to connect well with her and was able to get some good information from her. But these things happen, and we're lucky to have access to healthcare to treat these sorts of conditions.
All right. I just consulted the patient, and she's doing well. Well, she's really tired. She feels very tired. History of placental abruption, so recent bleeding. clots. I'm also gonna go appointment attending and present the case and then come back to the emerge.
Some of the things that I want to know about this patient are: how was the course of her pregnancy? Were there complications with her delivery? Did she have vaginal bleeding after her delivery? Was she on any medications? Has she had any history of vaginal bleeding, and so on? The whole point is to really be able to paint the best picture possible to gain context so that I can share with the medical team so they are better equipped to manage the patient. And the patient ended up being admitted for about 2 to 3 days.
All right, I just had lunch. Man, there's a lot of walking around for just working in the hospital. So I saw the surgery for 2 to 3 hours in the morning, then I did a consult in the emerge, and the resident was nice enough to buy me a small French vanilla. So I came up and finished my lunch, forgot my fork. Anyways, now I'm heading back down to the OR to see if there's any more surgeries or just helping out the residents with notes. So far, you know, gynecology week has been pretty nice. I mean, there's a lot of just watching and waiting for instructions, but it's more enjoyable or not as bad as I thought it would be. I really enjoyed it last week, so this week's a little interesting. Now, my feet hurt and I'm working from 8 p.m. to 8 a.m. So still I'm kind of worried about that shift, but hopefully I'll be able to see a birth or a couple tonight. All right, so the resident just asked me to go down to the emerge and do another consult for another vaginal bleeding case. So I'm just gonna make my way down on 7th floor. I'm gonna go down to the 2nd and then consult this patient, and I'm gonna do a speculum exam with the residents. And then I get to take a quick break before my next shift. Jess is working and I decided not to drive to work so I don't have to pay for parking. So I'm waiting for Uber, and Uber is cheaper than parking. So I gotta wait, go home, relax a little bit. Tired, feet hurt. Okay. Gonna be able to deliver babies tonight. It's gonna be cool. All right, I just stuffed my face. I ate a whole bunch of food because I was starving, and now I'm gonna go to sleep for about an hour and then get ready, wake up for a new day again, second part of the day. So hopefully I get to feel a little bit well rested after this nap. All right, I'm at the hospital, 8 p.m. Let's go.
When I first arrived at the hospital, I went up to the 8th floor and found the senior resident to see what was going on tonight. During this shift, I'd be working with a senior OBGYN resident and a second-year emergency resident. For the most part, it was a pretty calm night, and any consultations that came in, the emergency resident was the first one to see them, and she was pretty fast, which unfortunately left me with less of an experience, but it happens. You can't always see all the consultations. But I was able to see a patient with the resident that had just delivered a baby and had an ultrasound, and on that ultrasound we saw hydronephrosis, some fluid around the liver, and she had a lot of gas distending her bowels. She was in an extreme amount of pain, so we ordered CT with contrast to better visualize what might be happening. Is there bleeding? Is there an abscess? Unfortunately, I wasn't able to follow up on that patient, but I hope she's doing well. I'm sure she's doing fine. But that's the end of that consultation.
All right, so I met with the resident, and apparently there's 3 labors before I showed up. Now there's not many. One patient's being induced and she's in a lot of pain, so we are considering doing a C-section. But the resident, the senior resident and the junior resident are going down to the emerge to see a patient, and so pretty calm, which is I guess good, but hopefully there will be a birth. Obviously the C-section possibly on the way. Maybe some action tonight. I'm just gonna grab my iPad, do some studying while I wait for the residents.
On the labor and delivery unit, we had a patient that had been in active labor for several hours. She was having a lot of pain during these contractions, even with an epidural, and the fetal heart rate was tachycardic, so it's above 160 beats per minute. And the most common indications for a C-section include, in order of frequency, labor dystocia, abnormal fetal heart tracing, fetal malpresentation, multiple gestations, and suspected macrosomia. In this case, the patient had been in labor for almost 8 hours, was 8 centimeters dilated, was not progressing, and the baby's heart rate was tachycardic. With those factors in mind, the best thing to do is a C-section for the safety of the baby and the mom.
All right, patient is in for C-section. I'm gonna scrub in, so I gotta wash my hands now and then go into the room. All
All right, so the baby was delivered. We finally got called to do a C-section. They made the decision, they did the consent, and I was able to scrub into the surgery. So I helped the attending doctor and the resident do the surgery. So basically I just held the area open. I used towels to soak up some blood. I handed some tools or cut the sutures. And the really cool part is once they pulled the baby out, they let me cut the cord. So I actually got to cut the cord of the baby, and that was the very first C-section that I was part of. And I was able to cut the cord, so it was really cool. After the baby was, I got to pat down the baby a little bit, handed it to the dad. The dad was happy, mom was happy. So overall, really nice experience. Finished close to probably around like 1:15 in the morning. So it's probably like 2 a.m. right now. I don't think there's gonna be another birth. I mean, there is a patient that is in labor. She might be active labor, yeah, but we'll see how that goes. But really cool, got to see her C-section, another baby into this world. He's a cutie, so they're all cute, to be honest. Since it's pretty late at night at this point, I finished typing some notes up, and the resident told me I could go to sleep around 3 a.m. All right, I was just told by the resident that that's it for the night and that I can go to sleep. So this is the call room. A little bit different than the Cheeto call room. There's a computer here and there's the mirror. So it's just that delivery. There's a patient being induced, so we'll see if she's gonna give birth. Probably won't be for another couple hours, and I might not be here when she does give birth. But if there's anything that comes up, the resident's gonna call me. Anyways, until then, I have to make sure that I try to get some sleep because I'm tired and I need a good night's rest. So let's try to get a couple of hours in sleep. So far, this night's been pretty good. Hasn't been hectic at all. It's been pretty calm. All right, hope you guys doing well. Comment down below some of the things that you look forward to experiencing in an OBGYN rotation if you want to go into medical school, or if you are in medical school, or if you're not in medicine, what about obstetrics and gynecology interests you? What do you find interesting about it? I'd love to see that in the comments. I'm gonna go to bed and I'll see you in the next clip. So I didn't get called overnight. I was able to sleep well, but I did hear these alarms recently. And then I just heard the patient or staff saying, elevators aren't working. There's a fire on the 7th floor. I was like, like hopefully I don't have to evacuate the building. So I decided to get up to go try and find the resident before I head home to see if there's anything else that I need to do. And hopefully the elevators start working. I'm on the 8th floor. When I woke up at 7 a.m. in the morning, the residents had already done the handover and told me that I could go home. Overall, this is a very good introduction to a night shift in OBGYN. I enjoyed being able to deliver my first baby, see a C-section, and cut the cord. And I look forward to working on the labor and delivery unit in the next 2 weeks. All right, so I just finished writing my last note of the day, a discharge summary. Now it's time to go home.